Good morning, everyone. Thanks for joining us. My name is Stephen. I'm with the Flint and Genesee Chamber. I want to say thanks for joining us this morning. We're joined by Dr. Bobby Mukkamala, President-elect of the Michigan State Medical Society, and also a Genesee County resident. Thanks for joining us, Dr. Bobby.
Good to be here. Thank you very much.
There will be an opportunity for Q&A at the end, but feel free to drop those comments and questions in the chat. We're live on Facebook and YouTube this morning. The first question that I'd like to ask, can you start with just an overall health update for Michigan as a whole, and then talk specifically about Genesee County?
Sure. Yep. Thanks, Steve. So just to kind of put things in perspective, we are less than a month into the very first case that showed up in Michigan. So in Michigan, our first two cases came on the first day, and that was March 10th. So we're just shy of a month into it. And, fast forward from March 10th to April 7th today, and we have 17,000 cases in our state. So two cases about 3 weeks ago and 17,000 cases today. And so it's really spread quickly as was expected. I mean, any infectious disease specialist a month ago was quite concerned about this for exactly this reason, the rate of spread. And while the mortality rate, everyone was talking about, single digit percents, less than 1%, a small fraction of a large number is still a lot of people that perish. And so here we are 3 weeks later, and the numbers continue to go up every day. Again, 727 people have passed and 17,000 new cases. And just yesterday, so the one-day numbers, 110 people passed yesterday and 1,500 new cases were diagnosed. And so, you've heard a lot about the concept of flattening the curve. And the reason to flatten that curve, even if the curve with the big peak or the flat curve ultimately lead to the same number of people that pass, the flatter the curve, the less strain there is on the healthcare system. And that's kind of why everybody has been talking about flattening that curve. We don't want people to succumb to this disease because of a lack of equipment, right? We don't want to be in a situation of having to choose who ends up on a ventilator and who doesn't get on the ventilator. We want everybody that could potentially need ventilator support to end up on a ventilator. And if they succumb to the disease, let it be because of the disease itself, not because of a shortage of equipment. And that's why we want to flatten that curve to make sure that we don't get too many patients on any given day and run out of equipment at the hospital. And so that's why you're hearing so much talk about flattening of the curve. And based on the rate of increase of each of those numbers, the modeling that I've seen predicts that within this week, we should reach that peak in Michigan and start to come down the other side. And that would be fantastic news. It doesn't mean that everybody can go back to life as usual within a few days if we're on the other side of that peak and the numbers start to go down, because you can easily get what's been referred to as that double peak. So we'll still need to be diligent for some time to come, but it will be nice to be on the other side of that. And Stephen, you mentioned that there was another question, or what was the other part of it?
I think you kind of touched on both Michigan and Genesee County. And can you, I don't know if you can or can't, but on the, as we kind of reach the other side of the peak, what might that timeline look like? Are we talking about days or weeks or months before we can start to emerge from our homes again?
Yeah. So mathematically, I mean, if you think of it as a perfect sort of parabola, it took 3 weeks, we'll say 4 weeks to get to the peak. Mm-hmm. So 4 weeks from now, if we continue to be diligent, if the peak is indeed, let's say it's Friday. So 4 weeks from this coming Friday, we could end up getting back to that point where there are just sporadic cases and not this sort of escalation to the point, at the rate that we're seeing now. Mm-hmm. So, if that indeed is a perfect parabola-shaped curve, we're looking at a month from now, where we will be on the other side of it, and the numbers will be to the point where it could become life as usual, but with appropriate precautions, so we don't end up having another spike because we're careless about it. Would I want to be within 2 feet of somebody sneezing on me 6 weeks from now? Absolutely not. right? Because that person could still be one of those small number of people that carry this virus. And so I don't think it's going to be business and social life as usual a month from now. It'll still, but will we be able to go to the store for leisure, that sort of thing? Sure, probably. Will I want to go to a movie theater to go see a premiere on a Friday night a month from now? Probably not. Right? But I think it'll be something between, you know, being at home and only going out for absolute necessities to life as usual and going out to a movie. I think the recommendations will be somewhere in between there. We'll be able to go back to work for more than just essential things.
Mm-hmm. And so shelter in place or stay home, stay safe rather. Do you have any advice on, because if we're looking at a month, maybe, I know we're not holding to any kind of timeline, but any advice on what we should and should not be doing right now to help to further flatten this curve?
Yeah, I mean, I think that, the key is not wanting to transmit this disease. Right? And the problem is that this disease has this incubation period of about 2 weeks where you could easily be shedding the virus after having caught it from somebody else and not even have a sniffle or a cough or a fever or anything, but still be transmitting that disease. And so that's why it's so critical to follow the recommendations for shelter in place, and that you don't want to be unwittingly infecting those people around you. And so better to, if you're infected, to stay home. If you're not infected, to stay home, to not catch it from the person that's ignoring the advice and isn't staying home themselves. Mm-hmm. Right. And so sheltering in place is the way to bring down the numbers so that those people that are infected, sure, they may get infected, they may seek healthcare, but they're not spreading that disease for 2 weeks while they're waiting to figure out if they have it or not. Mm-hmm. So that's why it's so important to follow those guidelines and those recommendations, just so that we don't overburden the healthcare system and get more people sick faster than we can take care of.
Right. Talking specifically about business owners, employees, the workplace, can you offer some guidance on keeping health and safety a priority still?
So for example, my wife and I share a medical office. We've approached this with the philosophy that we are seeing patients in our office that if we don't see them, we'll end up in the urgent care or in an emergency room in an already overloaded system. And so that's sort of our litmus test when somebody calls for an appointment. If they have something that they decide, if I can't get in to see you, I'm going to end up in the emergency room for a nosebleed, a bad sore throat, a gynecologic issue that NIDA deals with. And so when those people come in, this is what our office looks like now. So we have a smaller working staff than usual. The people that can work from home, the billing folks, like things like that, they don't need to be in the office. They can remotely log in. So we have a smaller number of people in the office taking care of patients. We don't have patients sign in. The less they touch, the better. We arrange the chairs in the waiting room so that they can be 6 feet apart. We're spacing out the appointments so we don't have, any more people in the waiting room than necessary for that moment. And we're sanitizing everything. So there are things that can be done to minimize the transmission of disease in those places that have to stay open. I went to, I'm making masks. In fact, I got one right here. So we're making some 3D printed masks for healthcare workers that don't have access to N95 masks. And so I went to Home Depot yesterday to get materials to build those masks. And, they appropriately have the line that's 6 feet from the counter. But I'd say maybe half of the people were wearing masks. And the latest CDC guidelines that came out just this past week suggest that even in those social interactions, we should be wearing masks. They don't have to be N95 masks. They're not, those masks are in such short supply that we should preserve those for people that are truly exposed to people that are shedding viral particles. But for the average person, a cloth mask is something that should be fine to be able to prevent the viral particles or any particles from breaching and entering their airway. And so that's what I would recommend is the appropriate sort of, distancing, and then also wearing masks to prevent sort of unwitting spread of that disease.
Absolutely. On a lighter note, I know we didn't talk about this, but can you just tell us what you're doing with your free time? I know you mentioned the mask project. Would you like to tell us a little bit about that?
Sure, sure. Yep. In fact, well, let me see if I can make this work here. I'm gonna see if we can flip this around. I'll show you what I got going on. So about a month ago, I bought a bunch of 3D printers to donate to the Flint community schools because I thought that 3D printing was going to be something that school age kids, it would be a cool skill to know. And I sort of gave the analogy that Bill Gates in the 1980s had access to computers long before any of us did and spent thousands of hours programming on these computers and developed a skill set that was enormously useful, and the rest is history as far as Microsoft goes. And so I thought, well, how cool would it be if this 3D printing technology, what they call additive engineering, is something that our school kids could be exposed to, and get them in on the ground floor and get their thousands of hours of expertise and development and by access to this equipment that you would otherwise only find at universities and things like that. And so anyway, so I bought 20 some printers to donate to the Flint schools, and now the Flint schools are closed. So before they could take delivery of them, they were sitting in my basement. And so what I did was I assembled them, and you see about 5 or 6 of them here. So we're making these masks that were designed at the University of Montana. So they're called the Montana masks. And they're supposed to be nearly as effective as the N95 if they're sealed properly with the right filtration material. And the hope is to sort of fill in that gap so that true N95s that have been certified are available to the people that need them most. And those people that need something close, more than a handkerchief, but perhaps not an N95, might be able to use something like this. So this is kind of what they look like when they're done, and the filtration material goes over this opening. And then we fit them with some sealant, some elastic straps, and again, whether or not it's something that I'm doing to pass the time and prevent the onset of boredom, or whether or not it's truly helpful, remains to be seen. But yeah, that's what we've been up to for the past few weeks here at home.
I mean, that whole project just makes me smile. That is such an amazing use of time. And I mean, talk about leveling up. You were prepared to donate to Flint Community Schools, and you're just borrowing them right now to help contribute to such an awful crisis. Man, that's awesome.
Thank you. It's been fun. I mean, I've learned a lot about it, obviously, and it very much fulfills too. I'm a tinkerer, and this allows me to tinker, but for the greater good.
Mm-hmm. Do you have any? So, just sticking with this topic, do you have any tips or advice? Again, if we're looking at 4 weeks, 5 weeks, 6 weeks, what can folks be doing to just be mindful and just okay through this?
Yeah, I mean, it's a great question because were it not for things like you just saw, and my ability to occupy my time, that cabin fever that I see sort of setting in. We've got twin boys that are sophomores in college, and obviously they're both back now. One from the University of Michigan, one from the University of Chicago, that are doing online schooling in their room. And I think about every evening how many hours they've spent sitting in front of that monitor or in their room, whether or not it's playing an online game with their friends or discussing with their professors about their assignment. And one of them's got an organic chemistry test today. Just the mental health associated with being in the same place confined like that, and how that wears on somebody. And I'm thankful that I have an outlet like these printers to keep me occupied. I mean, so those things, they print every 3 hours. So every 3 hours, I'm going in there and tinkering it. My mind isn't spent thinking about, oh my gosh, how much longer do I have to be in here? And that sort of outlet is enormously useful. And I've had a honeydew list that's been getting longer and longer, and the spring cleaning, and so the ability to get out and do things in the yard. This, thankfully, this isn't the kind of thing that prevents us from going outside. And now that the weather is turning, I see more people taking walks in my neighborhood than I ever have. And so that sort of outlet, I think, to maintain our sanity so we can stave off cabin fever
Mhm.
is quite good, and that's what I find myself doing. And it's a great opportunity to get to that book that you've been putting off, that's been sitting on your shelf or your electronic device. And like I said, my house has never been cleaner.
Have you seen the meme of the husband vacuuming his roof? Um,
I haven't, but I'm just a few days away from that
yeah,
myself. I'm sure I've been thinking about I mean, just curious about what the inside of my gutter looks like randomly. I'm like, maybe I should go up there and take a look.
uh, a colleague of mine, Kathy, said this morning that this is kind of like a perfect reset button that you've seen. I don't know if you're part of that Facebook group, Crap I Cooked in Quarantine, but
Yes, absolutely. Pretty impressive cooking talent out there, and people I had no idea.
right, you see families cooking together, so many photos of food at the dinner table, time outside like this. There's always some positive to find in situations like this, and I would say that this is one of those things.
Yeah, no, absolutely. It's that's the silver lining on this cloud. I mean, the ability to spend time with our sophomore kids in college is not something that I would have ever expected.
Hmm.
And at the end, we'll see what our relationship is like after they've been stuck at home against their will for a
Right.
couple of months. I have a feeling it'll be good.
How many days for a habit? It's like 30 days or 90 days or, you know,
To before something becomes a habit, you mean?
yeah.
Yeah, no, I think that's about right, and we'll see. I mean, I think we'll all have our stories to tell about the habits we picked up during this.
Hmm. That's
But
right.
one thing that I will say about the again another aspect of silver lining. Um, so in the healthcare industry, the Center for Medicare and Medicaid Services has now sort of changed the way that we can deliver care to our patients on an elective basis, so that they don't have to come into the office. And
Mm.
so they've expanded the use of what's called telemedicine. And so now people that were technology averse and would require a patient to come to the office for an evaluation, and the burden associated with that, right? Somebody's got to take time off work to go
Mhm.
to the office for a 15-minute visit to make sure that their blood pressure medication is working, or that they're not having a certain side effect, that sort of, visit. I think the dynamic is going to change dramatically in the aftermath of this epidemic or pandemic, because we're realizing all of those inefficiencies and what can be accomplished um, via telemedicine using our EV technology to prevent those patients from having to come in unnecessarily. Right.
Mhm.
And so my wife, for example, she's an OBGYN. She has well women visits where it's mostly just questions, right? So how are you doing with this? How is this working? Any questions, any concerns?
Mhm.
And so now she does about 20 telemedicine visits a couple times a week from the desk right across here, right behind me.
Mhm.
And I think that's going to, I don't think that's a flash in the go away. I think it's something that a lot of healthcare workers and physicians will adopt as the new way to practice, so that they might do a day of
Mhm.
telemedicine a week and do it from home. Yeah. So I think it's going to change the
It's
way that healthcare is delivered.
and I'm willing to bet that additional industries will change as well. I made the comment earlier last week that prior to this, the chamber, we hadn't done webinars like this and give us 48 hours, and now we're doing them. And
Yeah,
this is a perfect example of an opportunity to really innovate, retool, try new things. Um,
exactly. Yeah. And they say that necessity is the mother of invention, and it's certainly necessary, and we are inventing.
mhm, absolutely. Anything else? Any other thoughts you'd like to share?
That I times whether or not this is a once in a generation or once in a lifetime sort of event that we're going through, or whether or not this is something that we will likely see again in my lifetime. And I don't have the answer to that question. I would like to think that we will learn a lot from going through it this time, and we shouldn't assume that it's going to be once in a generation and it'll be the next generation's problem to solve. In the way that we allocate resources, things like the N95 mask, so we don't have to be making them on our 3D printers here at home, things like ventilator supply,
Mhm.
the coordinated response, so that we're not, states aren't bidding against each other for access to these equipment. I think there will be a lot of lessons learned and a lot that should be pondered in the months and years that follow.
Mhm.
And hopefully it'll be a generation before we have another one, but we shouldn't assume that. And so I'll be eager to see how we think about this and what our response was and how it can be improved next time and how to avoid these pitfalls. I mean, you know, making mistakes once is that's how we learn, but making them twice in a row in this situation would
Right.
be a real failure. And I don't see that happening. I think we're going to rise to this occasion,
Mhm.
learn a lot from it, and do better next time.
I agree. I agree. I see a couple questions. We'll shift to question and answer. So, anyone who has any thoughts or questions to share with Dr. Bobby, go ahead and comment those right now. We have two so far. One from our friend Kitty. Is it okay to go through drive-through restaurants? Is it safe?
Yes. Can you still hear me? I just took my headphones out. Just
Yep.
Yep. Okay. Good. Yeah, it is actually. I mean, so you know, we drove around town yesterday. One of my sons and I in the car, and when you're in the vehicle, obviously you're not exposed to anything that you're not exposed to at home. And the drive-through window, they're behind glass, you're behind glass, you're talking through a speaker. The only thing I would say there is, the bag that they're handing you has been in a few people's hands, and being in a drive-through, you don't know how that bag was handled. And so, is it prudent to approach it as though it's been touched by somebody that might be shedding that virus unknowingly? Yes, that's prudent, right? And so, wearing gloves, using hand sanitizer, appropriately unpackaging things. There's videos now that are available on social media about, what do you do when you bring your grocery bag home? How to prepare and not just put stuff away, because that virus can live on these particles for hours and sometimes days. I'm sorry, on these surfaces for hours and sometimes days. And so, is it safe to do that? Yes. Is there a way to do it properly? Absolutely.
Good.
So yes, Kitty can keep shopping.
Good. Stimulating the local economy.
Yeah.
Uh, Another question. If you've tested positive, can you get it again or are you immune?
Yeah, good question. And I think it's one that we don't know the answer yet to. But, for example, rhinovirus is the virus that causes a cold. Does somebody get a cold once and never again? No, that's not what happens, right? And so the reason is that there are different antibodies necessary for different types of these viruses. And whether or not the immune response to COVID-19 is such that any such virus with similar antigen coding is now that you're now immune to just depends on the immunology of it. And so
Mhm.
whether or not it's like rhinovirus, where there might be a variant, all it takes is a little variation in the chemical structure of a viral particle to make the immune system no longer recognize it as something that it's seen before and have it be a new thing, like a cold.
Mhm.
And so I think that remains to be seen whether or not this will give us lifelong immunity, like the measles virus, for example.
Mhm. Any other waiting for the comments to come in. I did one thought that I had drive-through testing in Genesee County. Do you know? Are there any efforts taking place to do that?
Yep, very, very much so. And that's something also that, it would have been lovely to have had adequate testing earlier on in this process that didn't take days to turn around, right? And so as the testing has become more available, because it's been such a precious resource, the immediate results, that type of testing that gave you results quickly was something that was held only at the hospitals because they needed it the most, right? They need to know if somebody that's being admitted for presumed infection has that, and they need to know that quickly.
Hmm.
So what that left for everybody else was these results that were taking several days to come back. And now, finally, I think Abbott Labs is the company that has some testing that is much faster turnaround. So, minutes, not days.
Hmm.
And that's what we are hoping becomes more and more available so that you can get drive-through testing, right? That you can come through, get screened, determine. Now, this still isn't the kind of thing that's going to be so available that if you're just curious about whether you have it, you can go get it, right? This should still be somebody that has high exposure risk, that known exposure, some
Mhm.
symptoms, but not sure if it's a cold or whether it's this or whether it's the common flu. Those are the kind of people that we should still sort of um, offer these tests first to. It's not just, I'm just wondering if I have it, let me go and get tested. But yes, our testing capacity is getting ramped up, and the turnaround time on that is getting much better as well.
Good. Another question. My husband is petrified of my ultrasound visit at Hurley next week. I'm pregnant with twins and feel that the anatomy scan is important. How can I reassure him that the staff in the maternal fetal medicine ward is doing the best they can?
Yep. So, you know, this is a great question, because it's a question of, do we rely on faith that people are doing the right thing, or do we verify, right? And so I would verify. I would just, it doesn't hurt at all to call and say, hey, what's the process? What, from the car to the table with the
Hmm.
ultrasound probe on, how many people am I going to interact with? Where am I walking through? Am I walking right past the ICU? Am I pushing the elevator button that's been touched by somebody else? What sort of precautions is the institution taking to minimize my exposure, right? And see what those answers are like. I mean, I know that. And I know the folks at Hurley, and I've been talking to them almost on a daily basis, because that's where I do a lot of my cases. Um, and that's who supplied me with a lot of the materials that I'm using for the filtration on these masks. And so I know that they're for sure focused on exactly these issues. And I think that you will get answers that will appease you, and especially your husband, about the precautions you're taking. But these are the things, like touching that elevator button is something that we never think about, but it's clearly something we need to think about now. And so wearing appropriate PPE and asking those questions beforehand is the way that I think that will make you more comfortable with that visit.
Hmm. Thank you. Another one. If you go for a walk or a run outside, should you still wear a mask?
Yeah. So my family and I have been walking around the neighborhood, and there's no reason to wear one if you. I mean, these particles aren't just going to be sitting in the air of your neighborhood for hours on end, right? I mean, that's why Dr. Fauci keeps mentioning the 6 feet issue, right? So these are respiratory droplets that will drop to the ground. And so therefore you don't need to wear a mask unless you're around other people
Mhm.
that could be shedding those viral particles. And so when we walk around our neighborhood, no, we don't wear masks.
Okay.
But if we see our neighbor across the street that wants to come over and talk, we make sure that they stay 6 feet away, and we talk to them from the width of the street.
Yeah. Oh, that's a good measure. Extra cautious. Talk across the street.
Yes, there you go. Yep.
I'm not seeing any other questions. Always. Oh, and just like a tiny little PSA, the gloves. When you wear gloves in public, don't stop throwing them on the ground. I've seen
Yeah.
way too many gloves on the ground. The
Yeah.
environment is still important, and someone has to pick those up.
Yeah, exactly. And then the other thing about gloves is that, if the glove protects you from the viral particles. But if you touch something and it indeed has been contaminated, right? Like the shopping cart, and
Mhm.
now it's on the gloves, and then you are going around touching other things, you are still spreading those viral particles to those other objects, right? So just be cognizant of what the gloves are doing and what they're not doing. And so you don't want to be the vector of the disease, spreading it from the object you touched with the glove over here to a different object that you touched over here. So yes, it protects you, but we have a responsibility to make sure that we know what
Mhm.
it's not protecting other people from.
Exactly. I see one more. How many days after a fever do you go if you are self-quarantined? Is it 14 days?
Yep. So I think the question is, if you have a fever and you put yourself in quarantine, how long before you can
Mhm.
go out and resume? And yes, and so the what I've heard is also 14 days. Now at that point, we are continuing to learn a lot about this virus, right? And so if I had a high likelihood of having COVID-19, would I be comfortable 21 days later, hugging and high-fiving and touching other people? No. I mean, it's prudent not to do that, right? And so maintaining that 6 feet distance, even though the viral load has gone down to a minimal amount,
Mhm.
um, I wouldn't want to be too
bold about resuming normal activity at that point, right? It doesn't mean you have to be, locked in your room and away from everybody. No, you can get out there and you can take the walks and you can do those things. But I think there's prudence still in not wanting to take an unnecessary risk until, frankly, we know more about this scientifically.
Mm-hmm. Is it okay to wash gloves and reuse?
Yeah. So if you're talking about traditional disposable gloves, yes, soap and water can rinse off those viral particles, and I think that's fine. I think you're seeing a lot of people do that even with their N95 masks that are in such short supply, as using UV sterilization and reusing those things. Ideally, we would be in a situation where we didn't have to reuse single-use items. That's just not where we are. And so is it okay to do that? Yes. It's better than leaving it the way that it is, having viral particles on it, and hoping for the best.
I'm not seeing any more, and it's 10:30. Dr. Bobby, you're doing great things as usual. Thanks for taking the time with us this morning.
No, I'm happy to do it. And, this community is one that has faced many challenges, whether they're economic challenges, other public health challenges like the lead issue just several years ago. And this one is one that we happen to be going through with the rest of the world. And I think that, it's another opportunity to show our resilience, to be prudent, to not be an effort to emerge victorious yet again from another challenge, right? This isn't going to, we are probably better equipped than most communities to deal with it, given our history. And I think that we will prevail.
That's right. We are very resilient, and we've proven that time and time again.
That's right.
Thanks again, Dr. Bobby.
Absolutely. Thank you very much.
Just a reminder, this was recorded. We'll share it to our website if anyone wants to refer back to it. I see Kitty commenting that we should do this again. So we'll see in a few weeks. I might reach out again.
Sounds good. Happy to do it.
Thanks, everyone. Have a great day.